All right, so this is Testimonial Tuesday. So, yesterday I talked about two patients actually with X-rays that proved they were able to reinflate their disc through a thing called they had anterolisthesis, which means the bones slip like this. What happens is the disc should be nice and pumped up. It's almost like a tire. So when it's pumped up, it's nice and solid. When it loses some of its hydration, it becomes like a tire with less air, so it wobbles back and forth. When you pump it back up again, it's nice and tight. So that led me to think of the very first time, because I was pretty surprised to see that on X-ray, and two of them on X-ray, because that unequivocally proves that discs are becoming rehydrated by what it is we're doing. And so it reminded me of the first post MRI I had that surprised the living heck out of me. Now, I knew what we were doing, the robotic laser and decompression, was helping patients. So we'll talk about robotic decompression right now, robotic laser decompression. I knew it was helping because patients were getting better. We didn't have a lot of access to post MRI. In Canada, we sometimes we'll get a pre-MRI, but most of the time X-ray is the thing we have most access to because MRIs just aren't done as widely and enough, in my opinion, for disc injuries. But so we work mostly off X-ray. This is why this anterolisthesis thing on X-ray is just so amazing, because we can actually measure pre and post, and we're seeing regularly these pre and post X-rays improving. So back to this MRI, post MRI, it was a patient that had fallen on the steps and was a workers' comp case. And workers' comp, of course, wanted to pre and post MRI to make sure that the problem was gone. Actually, they wanted to do it to try to say there was no problem. But what this patient had was a sequestered disc. So when they had hit the steps that they fell on, landed on their glute on the right side, within 2 days, started feeling leg numbness, tingling, back pain, and weakness in the leg. Hallmarks of inflammation setting in on an acutely injured disc. So person hits, disc ruptures. Basically, the center of the disc pushes out and starts pressing into the nerves and starts irritating everything around with all the chemical irritants in what's inside the disc is supposed to stay inside the disc. When it gets outside of the disc, it irritates all the tissue around as a signal to the body that something bad has happened here. So I had all the hallmarks of this. So they pre-MRI'd it. They MRI'd, before we started treating. And there was a sequestered disc. So stuff had leaked out of the disc, had pushed out of the fibers out of the disc, and was sitting over here in space, and with a little bit of a fissure, essentially. So what comes through the disc is a little narrow herniation, and then all the junk gathers up over here like a tiny little golf ball over here. So what we're doing is trying to pull the disc apart to try to suck that back into the disc. And I thought, well, if the fragment that came out of that disc is larger than the hole that it came out of because it's gathered up over here, I'm not sure this is going to work very well. The patient should probably have surgery in this case. Didn't want to have surgery, understandable. A personal situation made it such that they didn't want to have surgery. So fine. So we started working on them. 3 months in, she's getting very, very good results. Pain is almost gone. We were pulling on her back, pulling on the leg, also to focus on that right side where all the issue was. Of course, workers' comp wanted to post-MRI this, so they did. Post-MRI was about maybe 5 months in, thinking 5 to 6 months in. 5 to 6 months in, that disc sequestration is gone. Can't see it on MRI. Everything looks healed on MRI. So pre-MRI, sequestered disc fragment way over here in space, pushing on the nerve root. MRI within 6 months of treatment, no sequestrated disc anymore. 3 months of treatment starts getting almost complete resolution of symptoms. Now this patient does treatment every 2 to 4 weeks, depending, just to make sure that they don't re-injure that spot. Because with an injury, of course, you're sometimes under a situation where you can re-injure. If I've got a bad shoulder, I can strengthen it, but is it ever going to be as good as it was 100% new? Am I ever going to be guaranteed that I don't injure it again? I'm not. That's just realistic. I do have a bad right shoulder. I know that I can injure it again. I have to be a little more careful with it. I have to rehab it properly, keep it strong. That's just a common sense thing. So with back pain, it's the same thing. If you injure it once, are you ever going to be able to fix it? Even with surgery, if you're going to be able to fix it so it doesn't get injured again, it's impossible to guarantee. But you can do things to make sure that you keep it in decent shape, and it lowers the chances of re-injury. Maintenance care does that for someone with a spinal injury. So this patient maintains maintenance care, and amazing results. She hasn't had a problem since. So there's your testimonial. Really bad disc injury that even I at the beginning thought that it wasn't going to be able to help, and it did help. And that's what we like to do for tens of thousands of patients throughout all the clinics that we have these devices in. That's why we're here. That's what we do for people. And if this is something that resonates with you, definitely get in contact with us. Thank you for watching Testimonial Tuesday.